Physician's Declaration of Independence is now over 10 years old. I first wrote it in 2003. I've updated it several times. I was going to read through it, but I don't want to do that. We don't have the time. But I will just quote a couple of lines from it. Of course, I just took the old language from the founders and just replaced it with our current situation. We hold these truths to be self-evident, that the physician's primary responsibility is toward the patient, that to assure the sanctity of this relationship, payment for service should be decided between physician and patient, and that, as in all transactions in a free society, this payment be mutually agreeable. Only such a financial arrangement will guarantee the highest level of commitment and service of the physician to the patient, restrain outside influence on decision-making, and assure that personal information be kept confidential. The financial arrangements between physicians and the third parties have become so destructive to the patient-physician relationship and to the medical profession as a whole that it is the right and obligation of the members of the profession to abolish them. So then I go through the whole litany of all of the insults against the profession, starting back during World War II, when we had wage and price controls, right? Socialism, FDR, the communist influence in the FDR's government, wage and price controls, which led to the use of the health subsidy, the health benefit as a wage in kind, which retained its tax-favored status, which really started us down this road. I'm not going to go through the others. Jane mentioned some of them. HIPAA, the HMO Act, bringing HMOs into existence, the RVS with price controls, and then, of course, the sustainable growth rate formula, which is a total disaster and which we're apparently going to be stuck with. And further, we've been pushed into these payment for performance schemes. We are forced now to pass these maintenance of certification exams. All this stuff is just piled on top of us. And then, of course, Obamacare, which is really the end stage of this whole process. So where are we now? I mean, look at how far back this goes, back to World War II. The progressives, the left, have been trying to gain control of healthcare since the era of Wilson and Teddy Roosevelt. Why? Because then they can control the individual. They control healthcare, they control the individual. Domination of the medical profession tries to justify itself with this notion of healthcare being a right. It is not a right. There is absolutely no basis for that argument, though people say it all the time. It's a service that requires the labor of others, and to make it into a right ultimately leads to the enslavement of the people who are going to provide that service. This service that we provide requires an extremely lengthy apprenticeship and period of study, a lot of commitment, sacrifice, and we are entitled to be well compensated for this. By the way, one of our people in our email thread wrote that we should probably get rid of the term healthcare. I mean, this is true. Healthcare is a term of the left, and it suggests that this is something that anybody can do, right? That you can be a healthcare provider, but what we do and what we are trained to do is take care of patients who are sick. We provide medical care to sick patients with diseases. And this is what distinguishes us from the average chiropractor. I hope there are none in the audience. I don't mean to offend. Chiropractors are good people, and I've had to call on them occasionally myself. So we've been singled out for abuse. We're on the leading edge, if you will, of the front line of the assault on liberty. Our profession has been subjected to virtual enslavement over time. Try to imagine lawyers accepting price controls, right? They'd laugh you out of the room. Also, this has been done over decades. Imagine if it had all been enacted right away, right? It's the frog being slowly boiled analogy. Or a better one, how do you trap wild pigs? This is from Russia. You throw a bunch of corn into a field and you lure them out there, okay? And then they eat it, and the next day they come back and there's more corn there for them. So they keep coming out, you keep throwing the corn out, and you gradually erect fences around where the corn is. And before you know it, they're fat and they're satisfied, and they don't even notice the fences. They're happy to be enslaved. They're happy to be trapped. Of course, you know what happens afterwards, right? They become dinner or breakfast. So what is going on in 2015? Things have taken a very bad turn for the worse lately. And not only are we continuing to be constrained financially and forced to waste increasing amounts of our precious time doing unnecessary paperwork, entering data into electronic health records, doing maintenance of certification nonsense exams, we're also now being told how to treat patients. We're being forced out of private practice. I mean, you heard today the numbers. A third of doctors are in private practice from 2/3 just a few years ago. I mean, it's totally scary. Once you're in the hospital, which of course is where I am, but I've been there the whole time, I know what they're up to, the hospital financial priorities will negatively impact quality of care. Hospitals are also the vehicle through which the government and other payers are going to try to control the medical profession. So they want us in the hospital setting. Of course, you also know that anything that you do in the hospital costs twice as much as it does in private settings. So this is causing a huge increase in the cost of care. But nobody really cares about that. They're all happy about it. They're all happy about it. This is the problem. This is the problem. Also, central to this whole effort, which is focused in the hospital setting, is the forced adoption of electronic health records. And they've forced us into this through both mandates and bribes and now penalties if you don't keep up with it. And of course, there's nothing necessarily evil about an electronic health record. I could put one on this computer in a matter of a few minutes. I could download one onto my phone. That would be perfectly adequate. What really is offensive is the meaningful use, the fact that you do have to start reporting private patient information to central authorities. And what are they going to do with this information? Well, there's nothing good that will come out of them getting this information. They're going to use it to, first of all, be able to look over our shoulders and actually micromanage what's going on in the doctor's exam room. Also through the electronic health record by inserting algorithms, and this is well known, and they don't even conceal this stuff. You can find out all this stuff easily. And what's the goal? Why are they trying to micromanage our practice so much? There are two main goals. One is to, of course, limit what is spent on patients' care. And the other now is to push their favored treatments. They're actually telling us what to do, what to prescribe, and we have given them the information to do this through the practice guidelines, which our elite academic physicians continue to write. The whole concept of insurance has been turned upside down because, of course, it's not insurance anymore. It's prepaid care. You're just recycling healthcare dollars through, or medical care dollars, I should say, through these entities that skim 20% off the top and then decide how much they're going to spend for your healthcare. And they'll pay for routine, low-level stuff, the so-called wellness care and the preventive care that, of course, is mostly nonsense. Let's be honest. We all know the prescription for a healthy life. Okay, you can give that out to somebody in about 20 minutes. You don't need to have a whole industry devoted to this. But then if you really get sick and need an expensive operation or expensive procedure, oh, no, you can't have that. You can't have that. No prior authorization. You have to go through that hurdle. They want to discourage the use of anything that's more than, the cost of an aspirin. So at the same time, this so-called standardized care, which is being formulated by the practice guideline panels, and these panels, of course, are dominated by doctors who have industry contracts of various type, and they are pushing this on us through these guidelines, which depend on what we call evidence-based medicine. And if you were at our meeting back in Charleston, we totally demolished evidence-based medicine and deconstructed it into what it is, which is a cargo cult science that is little more than junk. I mean, it is totally worthless. The Affordable Care Act is best viewed not as socialized medicine, which of course it is to an extent, obviously, but it's really crony capitalism. And crony capitalism is the polite word for fascism. It's the government picking and choosing favored industries and favored companies and favored people and diverting money to them. And why are we having trouble changing the healthcare system? It's because of crony capitalism. because all these people who are feeding off of this multi-trillion-dollar pot are not going to go away. They're going to fight like hell to retain their piece of this huge pie. So we heard numbers. I mean, multi-trillion dollars are being spent on healthcare, most of it going to people who have absolutely nothing to do with actually providing healthcare. And of course, if we went back to the sane system of having people pay the doctors directly, the volume of service and the utilization of the healthcare system would drop to such an extreme low level that these insurance companies and hospitals would be very quickly out of business. And they can't allow that to happen. So everybody has a stake in the perpetuation of this incredible, incredible gravy train. So look at who backed Obamacare and look how they have been rewarded, okay? Follow the money. The insurance industry is seeing record profits. And it's so obvious. You don't have to be an expert to know this. They got the government to put in all these mandates for things that you'll never possibly use, which then justifies the insurance companies ramping up the premiums. And that money is all theirs, all right? Because with the deductibles going up, you're never even going to tap the insurance. It's a total giveaway to the insurance industry. And then if you can't afford the premiums that are ramped up, we're covering it. The taxpayers are paying, and 90% of the people who've gotten Obamacare policies are subsidized by us. So for-profit hospitals just had a banner year. This has just been in the news. They're seeing a lot more admissions in Medicaid, Obamacare. They're coming into the hospital because, of course, doctors are not seeing them. The AMA is raking in money on their CPT coding monopoly. The AARP is selling record numbers of their Medigap policies, right? And Big Pharma is making sure through the electronic health record and these guidelines that everybody in the country is taking a statin, an ACE inhibitor, an SSRI, and Abilify. I mean, for a nightcap, you need Abilify. Abilify, as you probably know, is the biggest selling drug in the country right now. Now, there were some people who were disappointed. SEIU, big backer of Obama. Andy Stern was the most frequent visitor. President of SEIU was the most frequent visitor in the White House during his first term. Well, a lot of Medicaid money flows to the SEIU, who control the hospital workers. So that was a big giveaway to them. And they were, of course, disappointed that 36 states did not expand Medicaid. But of course, that was the intent of the law. And that was the only thing decent that occurred with the Roberts decision, was that they made it possible for states to turn down the Medicaid expansion and not get penalized. So what about the political landscape? Well, you heard from Charles. I think it's a very scary time to be an American. We have a rogue president. He ignores the Constitution. He flagrantly bypasses the legislative branch by unilaterally changing statutes, decides not to enforce certain laws at his whim, writes new law, as in his recent declaration of amnesty for some 4 or 5 million and probably many more people. And in spite of 2 landslide elections over the last 4 years where we returned control of Congress to the Republicans, Republican leadership has all but capitulated to the dictator-in-chief that we have now as a president. The congressional leaders are, in fact, big government rhinos. They themselves are feeding at this trough, and they enrich themselves by exercising power on behalf of their backers. This is why I'm not very optimistic of seeing anything meaningful get through the government, get through Congress. We are living, to quote Mark Levin, we're living in a post-constitutional republic. Our vote doesn't really count for very much anymore. So much of what is going on in Washington, D.C. is beyond the reach of the voter. Just think of the massive administrative state that has grown up over the last 40, 50 years, run by unaccountable, unelected bureaucrats. They issue tens of thousands of regulations every year that affect all of us in ways that we can't even understand. We are unaware of this stuff. The Federal Register has got to be the largest book in the world. And what about the judiciary? Well, for the most part, they are rubber stamping this unconstitutional shadow government, the administrative state. They get a pass. And of course, Obama, with the help of Harry Reid, has successfully packed the federal judiciary. So don't expect to get relief from the court. And look, we have King versus Burwell going to start to be heard in a couple of months, where this is clear, but we also thought the Obamacare individual mandate was clear, but that went against us. Why? Because somehow they got to John Roberts. So has he made amends? Is he going to show some backbone this time around? I wouldn't hold my breath. I wouldn't count on it. So it's never been more important than it is now to have an independent medical profession. There is absolutely no doubt that Obama and his cabal would like to outlaw private medical practice. And many academic physicians would support him. There's tremendous enthusiasm for ending fee-for-service medicine throughout all of academic medicine. And with it will go private practice, because obviously you can't do private practice unless you're getting some fee-for-service or unless you got a concierge model of some sort. And given his dictatorial tendencies, his phone and his pen, and the fact that he's already changed Obamacare unilaterally so many times, and Obamacare has so much power concentrated in the federal government, just built into the legislation. The Secretary of HHS shall, giving all this extraordinary power to the executive branch. Why couldn't he just say that, sorry, if you don't want to participate with Obamacare, well, you're not going to be able to renew your license, or we're going to have this mandatory maintenance of licensure exam that you'll be sure not to pass. So we need a critical mass of truly independent doctors who in turn are going to be treating a very large number of patients to be able to stand up against this kind of a move. And we need a core of doctors who are going to pass on the art of medicine to the next generation, because the academics aren't doing it. In fact, they're really giving them the opposite. They're giving them the social justice version of medicine and the Hippocratic Oath rather than the true thing. So if we don't teach the next generation, they're going to get the wrong information and they're not going to be as good doctors. So there's a lot at stake here with independent medical practice. I've spoken long enough. It's time for dinner. Try not to trample each other. There's plenty for everybody. Thank you very much.